Welcome once again warmly to the Engaged Anekāntavāda speaker series. I'm Christopher Jain Miller, the VP of Academic Affairs here at Arihanta Institute, and I'm pleased to introduce this event and welcome all of you warmly. I see so many of our graduate students, community members, professors, and friends from all over the world as attendees, and that's always a wonderful thing. So thank you for coming. We are going to start this event practicing Anekāntavāda in times of crisis, public dialogue, health, and vaccine hesitancy with Professor Ana Funes in just a moment. And as always in the Engaged Anekāntavāda speaker series, I'm joined by my colleague, Professor Anil Mundra, who's going to preside over this event. We give particular thanks to the Uberoi Foundation for their support for this speaker series, as well as the whole Engaged Anekāntavāda project that we're doing this year at Arihanta Institute. And I, of course, just want to let you all know from the technical side that you can ask questions at any time in the Q&A box here in Zoom during the event and afterwards when we will have time for a discussion. So without further delay, I'll now introduce our moderator and presider, Professor Anil Mundra, who is the Bhagvan Vimalnath Assistant Professor of Jain Studies and South Asian Religions in the Department of Religious Studies of the University of California, Santa Barbara. He was previously the Alka Siddhartha Dalal Postdoctoral Fellow for the Study of Jainism at Rutgers University in New Brunswick. His research focuses on how South Asian philosophers navigate religious diversity, especially in Sanskrit texts, on the classical Jain theory of non-one-sidedness, Anekāntavāda. He was also a presenter in our Engaged Anekāntavāda conference that we had just last week, and many of you were there, and we thank you for coming to this event. I'm now going to turn it over to our presider, Professor Anil Mundra. I'll give you the stage, Anil. Thank you.
Thank you very much, and thank you all for doing this, and everyone in the audience for being here. So this is now the second installment of this series that we're doing, beyond the conference that you mentioned that we just had last week. And as I said at the first time at the first edition of this last month, I first got interested in doing research on Anekāntavāda because I thought it seemed like a really promising way to deal with a whole bunch of the challenges that we face in the world. And as I see it, that's what we're doing in this series is asking those questions. And so I'm really glad to be part of this series. We've sought to curate a series of scholars that have a somewhat rare combination of characteristics, both academically rigorous and also concerned to apply what they know and not leave it as being purely academic, as they say. And Ana Funes is definitely one of those in my book. Our speaker today, Ana Funes, is assistant professor of philosophy at Fairfield University, where she teaches Asian philosophies and East-West comparative topics in philosophy. Her research seeks to establish dialogues between phenomenology, feminism, and notions of bodily self-awareness in the Indian philosophical traditions of Sankhya, Yoga, Vedanta, Advaita, and of course, Jainism. She co-edited with Christopher Chappell the book Thinking with the Yoga Sutra, Translation, Interpretation, and has published several articles on Sankhya Yoga philosophy in specialized journals. She's currently writing a manuscript on the ethical dimension of prana in the history of Indian philosophy and its implications for an intercultural philosophy of breathing. So now, without further ado, I present to you Professor Ana Funes and her talk, Practicing Anekāntavāda in Times of Crisis, Public Dialogue, Health, and Vaccine Hesitancy. Please, Professor Funes.
Thank you. Thank you. Let me start my presentation. I think you can see it, okay? Well, I just want to start by expressing my gratitude to Arihanta Institute, to Chris Miller, to Anil Mundra for inviting me to be part of this conversation on Engaged Anekāntavāda. I want to thank the people joining this live conversation and for those of you who will be watching later in the recording. I was able to watch the first talk in this series by Professor Raja Rosenhagen, who I thought gave an incredibly illuminating talk in terms of how to navigate the algorithmic grab that technology has on our lives. So if you haven't watched that talk, please go back to the first talk in this series. Because I think that Dr. Rosenhagen showed us in a very clear way how Anekāntavāda can reintroduce difference within absolutizing logic that is built into these systems. And this connects with a concern that I also share regarding those instances when it becomes impossible to express what matters to us, especially during moments when people feel vulnerable in the face of other people's decisions. And in particular, this was the case during the COVID pandemic, where many of us observed all of these disagreements over vaccination, generating fear, anger, political polarization, and even moral polarization. In my case, I was observing how people were losing friends and even partners and potential partners due to differences in the view on the vaccine. Families were distanced not only physically but also emotionally. And in general, people became distrustful of each other in ways that prevented the possibility of authentic dialogue with those who felt differently about how these public policies were being implemented. So, for practical and theoretical reasons, I became interested in the way COVID vaccine hesitant individuals were being portrayed by the media, by, in daily conversations, and also in scholarship, where they were not ridiculed or politicized. They were dismissed as irrational and sometimes even as unethical. And it was this appeal to rationality that most caught my attention. When looking at the scientific and social studies that try to make sense of vaccine hesitancy in general, but of the COVID vaccine in particular, which is what I will be focusing on this talk, most of these studies are motivated by the belief that if we can better understand the reasons people refuse vaccines, then it could be possible to better determine strategies to engage with them and reduce vaccine rejection. And so, to this end, when looking at philosophical discussions on the phenomenon, which is my field, I found that a lot of these studies focused on whether there are rational grounds to believe that one should not be vaccinated despite there being enough evidence of vaccine safety and efficacy. So, when looking at this, at the conversation in terms of a more scholarship way of looking at this, in general, I was finding analysis that distinguish between beliefs that are rational, beliefs that are coherent but false, and rational beliefs that were epistemically and also sometimes morally misguided. And as I was looking into these studies, I began noticing that none of them were mentioning the type of people that I was having conversations with, that I noticed that they were not being taken into consideration in any of these debates. And so I thought that it would be important to take them into consideration as well, which is the type of people who are not necessarily who are rational and not necessarily epistemically nor morally false, or not necessarily, at least not prima facie false, meaning that without knowing really and understanding the reasons for refusing the vaccine, it would be too fast to call them as having false beliefs or as being immoral. So I was particularly interested in trying to understand that group of people, and particularly I thought of the theory of the Jain theory of non one-sidedness, because I thought that if we could apply it in this very controversial case and this difficult situation, it could help us better characterize the phenomenon of vaccine hesitancy, create conditions for authentic dialogue, and find better ways to address everyone's safety and health concerns. So I thought that, well, if I want to apply the theory of Anekāntavāda to this very difficult case, I first need to understand the theory well. And so for this, I relied on the work of many scholars who have done a very good job in translating text where the doctrine is conveyed and also helping us interpret it correctly. And so in this sense, according to the ontological aspect of the theory of Anekāntavāda, and here I'm going to do a little bit of theory, so bear with me. So according to the ontological aspect of the theory, every object has infinite number of attributes, which entails the possibility of attributing contrary properties to any real thing without contradiction. And this is so because each of these properties is non-exhaustive, which means that each property is predicated on an object from a particular perspective and emphasizes a particular feature. So I thought that a proper understanding of a particular object, in this case, the object of vaccine hesitancy, would ideally require a complete account that included all perspectives together, or that at least tried to gather as many perspectives as possible that were relevant to the issue at hand. And so when I decided to apply this framework, so I decided to put it in this way, right? In a certain sense, vaccine refusers are irrational. And so there were studies that characterize this type of vaccine refusers as those with whom it is impossible to have a rational conversation, meaning that it seems impossible to convince them of the falsity of their beliefs, despite the evidence provided. So in general, the anti-vaxxers, the so-called anti-vaxxers, are put in this category for having beliefs that cannot be revised under any possible scenario. So these are people who presumably hold beliefs that that could contradict each other, that do not hold up to logic or probability, and are full of prejudices or hard entrenched emotions. And this type of group are usually influenced by conspiracy theories, which typically promote a paranoid view of the world or create unfounded feelings of persecution. So there were some examples about people who believe that vaccines contain surveillance microchips or that were a form of gene therapy and population control. So they were characterized as irrational by some of the sources that I looked into. But then, in another sense, vaccine refusers are not irrational, but also not fully rational. And here we have philosophers like Alex Wursnip, who argue that we should not see anti-vaxxers as completely irrational, for it might be the case that despite holding false beliefs, such as the belief that vaccines are not safe, effective, or useful for the community or oneself, those beliefs are coherent with each other. So Alex Wursnip thought that this type of anti-vaxxer could be understood as structurally rational in the sense that, yeah, they can have a coherent view among the beliefs that they hold. But when you look deeper into the content of the beliefs, those beliefs there are no good reasons to hold those beliefs because there is evidence that show those beliefs as false, right? So they might be coherent in what they believe, but those beliefs are not true. And then in another sense, I found those who were characterizing vaccine refusers as fully rational, but somewhat misguided. And this was a very interesting characterization because contrary to what Worsnip's analysis might lead us to think, not all vaccine refusers or vaccine hesitant individuals, which I use alternately, are anti-vaxxers. This type of studies started to show that many individuals who believe they should not be vaccinated do not necessarily think this is true for other people. This type of vaccine refuser is rational because even if the content of their beliefs were false, for example, that the vaccine was not safe or effective for the community, the reasons why they believe them are epistemically correct, in the sense that there are facts about the world that justify having those beliefs. So, for example, a lot of people who were hesitant about taking the COVID vaccine came from communities that have experienced historical trauma, like communities that have been subjected to historical racism, that have been subjected to medical systems and unethical ways of doing health research. We are talking also about people who have had negative experiences in the doctor-patient relationship, such as sexism, paternalism, or even epistemic dismissal of the particular concerns that they have by certain healthcare personnel. And there are also reasons for distrust that come from what some called epistemic pollution, which includes context where people become aware of scientific biases, the scientific crisis, like, for example, the non-replicability of results, or conflicts of interest. A lot of people were hesitant because of this the pharmaceutical involvement in the research at the same time. But at the same time, this group is surrounded by confusing information or misinformation that prevents people from distinguishing cases where there is indeed scientific consensus, or cases where we can indeed arrive at true conditions. And these can also be influenced by medical populism, which constructs exaggerated antagonism between people, experts, and institutions or the establishment. And so this case was very interesting for me because they were showing that the problem of vaccine hesitancy was not just one-sided, was not just about these people who don't want to get vaccinated, but that it was a bigger problem, a two-sided problem, where people in the medical field also expressing lack of humility or lack of willingness to understand the concerns of these individuals were also part of the problem. So this type of vaccine refuser is considered rational because there are objective historical reasons to doubt the trustworthiness of mainstream scientific institutions. And although their cognitive process of deliberation could make them believe falsehoods about the vaccine, presumably these are people who would be able to change their false beliefs about the vaccine if they were shown, first, that institutions are in fact trustworthy, and second, that there is overwhelming evidence against what they believe is the case about the vaccines. So this view acknowledges the responsibility of physicians, medical establishments, and governments for having created conditions for vaccine hesitancy when they discriminate, ignore, or alienate patients, especially those from marginalized groups. So while this characterization avoids presenting the issue as only a matter of personal responsibility to vaccinate, I thought that it did not portray all the vaccine refusers that I was also being aware of, and that didn't portray all vaccine refusers as epistemically or morally flawed, but it still was leaving those who could probably not necessarily be be morally flawed. And that's why I wanted to explore this other possibility that there was another sense in which vaccine refusers were fully rational, but not necessarily epistemically nor morally misguided. So here I need to spend a little bit of time characterizing this type of vaccine refuser because it's perhaps the most controversial and the most difficult to understand. So let us for a moment consider this type of vaccine refuser who is not an anti-vaxxer, but who would not change their beliefs about the vaccine even if biomedical institutions recovered their trustworthiness, and whose beliefs about the inappropriateness of taking the vaccine were not necessarily false. I think of this individual as not necessarily coming from a low income or marginalized context. This individual might be from a middle class, well educated. Uh, it has adopted a healthy lifestyle, is aware of diet, is aware of exercise, is an individual committed to good habits like not non-smoking or drinking. But it is a type of individual that is very interested and has some sort of knowledge of complementary and alternative medicine and may or may not be a doctor herself. So I'm calling this type of vaccine refuser the refuser, the complementary and alternative medicine refuser. This means that this is a person that no matter how safe or effective vaccines are supposed to be, she does not think that she, and perhaps also others, should be vaccinated, nor that the vaccines are the only way to protect society from the perils of disease, because there is another way of looking at health. So this is a type of vaccine refuser that has alternative views of health and decides to refuse the vaccine because they conclude that they prefer another way, for example, a less chemical, less invasive, or a more holistic way of preventing disease and staying healthy. Now, it is easier to understand those who develop distrust in the medical system due to grievances, such as the ones mentioned before, like racism or marginalization. It is, however, less clear why someone coming from this context, right, a middle class, well-educated individual with all of these characteristics that I have shared with you, it is less clear to understand why, if these people have full access to reliable sources of communication, decides to refuse the vaccine without being seen as a result of poor judgment, cognitive bias, maybe even privilege, or scientific illiteracy or misinterpretation or anti-expertise, or even having an individualistic attitudes. And yet it is precisely this type of individual who refuses vaccines on the basis of alternative views of health, which I think has been and was ignored in all these conversations, studies, and portrayals of vaccine hesitancy. So, of course, there is this type of vaccine refuser poses a challenge, right? How are we supposed to deal with people who refuse vaccines because of a disagreement on foundational premises about what is considered to be the best way of coping with illness and disease? And the other question that I had to ask was, would it be even legitimate to use Anekāntavāda to show the standpoints or viewpoints under which the property of being fully rational and not misguided could be attributed to this type of vaccine refusers? So here I agree with Anil Mundra, and I'm really happy that he's presiding this event because he will be able to tell me whether I misapplied it or misinterpreted in some way. But I agree with Anil Mundra in that Anekāntavāda is not a relativism nor a skepticism, because it's originally a claim about the ascriptions of properties to things and not about whether a certain proposition is true. So in this sense, we cannot use Anekāntavāda to legitimately assert, for example, that the proposition vaccines are safe is only true under certain criteria, let's say the biomedical, but false under another, let's say under the holistic view of medicine. So I'm not proposing this type of application of Anekāntavāda because, again, I agree that Anekāntavāda is not a relativism, is not a skeptical theory of knowledge, and there is no place in using it to question what has already been established as a fact. And I agree again with Anil that after all, an argumentative discussion can only get off the ground if there are at least some premises shared by the interlocutors. But this is precisely the reason why I think Anekāntavāda is necessary in this case. For it is possible for a vaccine-hesitant individual, like the CAM refuser, to believe in scientific expertise, to agree with scientific authorities that the vaccine is reasonably safe and efficient, and yet disagree with the public health policies that demand everyone to take it. So this takes us to the epistemological aspect of the theory of Anekāntavāda, where the meaning of a term, where we can see how the meaning of a term depends on the understanding that it brings to mind, based on which the subject establishes a relation between the term and its designation. Now, according to Haribhadra, and he makes this very clear, there are four standpoints or parameters under which every term can be analyzed. You have time, space, substance, and state. So when predicating any property of an object, we naturally do it from a particular perspective and emphasize a particular feature. So for example, consider the typical case given in the Jain tradition. When we say that a pot is made of clay, it is also true that according to its substance, it is not made of water. And according to its place, it is both made in Mexico and not made in the US. Or according to time, it is located in the porch in autumn, but not located there in the summer. And if attending to its condition of color, it is both black and not red. So if we attend to the case of the COVID-19 vaccine, and I will leave the question open as to whether this argument that I'm making applies to the case of vaccine hesitancy in general. So right now, my argument is only focusing on the case of the COVID-19 vaccine. So if we apply this framework to the case of the COVID-19 vaccine in relation to its substance or material constitution, we find that the vaccine, we can say that the vaccine exists as constituted by mRNA, its active ingredient, while it does not exist, for example, as constituted by herbal or natural ingredients. And it is the property of not existing as constituted by herbal or natural ingredients that is picked up as relevant, as a relevant feature by CAM users. And that is then contrasted with what they understand as healthy or as a preferable way of dealing with disease. So it is precisely the difference of perspectives at the level of the representation of an object that gives rise to the disagreement. But this representation, which ends up being expressed in the form of contradictory judgments in the public arena, for example, each of us should get vaccinated versus the contradictory claim that I should not get vaccinated. And I put the asterisk because that each of us, meaning each of us, provided that there are no counterindications, and I don't have any counterindications, so I am part of that each of us. So these would be contradictory judgments. Or we have the other pair of contradictory judgments by those who thought that vaccines are the best way to protect us from COVID, or vaccines are not the best way to protect us from COVID. Right? So these contradictory judgments are arising from compatible but competing properties of the substantial mode of the vaccine. And so in its if we go back to the ontological aspect of Anekāntavāda, which holds that reality is constituted by things that are interconnected with other entities, including subjects, through infinite relations that give way to a vast range of properties that can be predicated on a given entity with equal right, then each perspective being equally justified due to the infinite manifoldness of interdependencies. So I think this is the case with this type of contradictory claims that come from different ways of representing the properties that can actually be ascribed to the object. And it is the way in which those representations arise out of compatible properties that can indeed be ascertained of the object, which creates the disagreement and which makes it a possible case for dialogue. Now, I am aware that there are big and important objections against this way of understanding the application of Anekāntavāda in this particular case, because some people could say, well, preferring less chemical, less invasive, or more holistic ways to prevent disease or to stay healthy is fine when those decisions do not affect the health of others. But when one's decisions to live a more holistic life has harmful consequences on others' well-being, as is the case with vaccine-preventable diseases, then refusing public health policies shows only an anti-scientific attitude and a selfish disregard for the community's well-being. And surely, one could argue that some perspectives should be prioritized over others, such as a scientific perspective over a pseudo or anti-scientific one. And here, I'm going to offer a response first to the second objection, because it's the easier one, and I'll try to propose a way of answering the first objection at the end. So I think we can say that if we apply the non-one-sided view of reality, meaning that, some perspectives should be, the statement that some perspectives should be prioritized over others is true within the context of establishing scientific facts, right? So if we, within the context of science, you cannot have a relativism that is relativizing the whole scientific enterprise. So I agree that in that sense, prioritizing the scientific perspective should be done within the context of establishing scientific facts. However, when it comes to make sense of those scientific facts in relation to the rest of our experiences, values, worldviews, and interpersonal context, the scientific perspective, especially the kind that excludes the subjective dimension of our lives, becomes just one of the multiple viewpoints that needs to be considered. And so this is why I think that labeling these type of vaccine refusers as anti-scientific or pseudoscientific would be illegitimate, because it's taking the viewpoint of the institutional experts as the only one to guide their decisions for what is best in their lives. And I agree, I mean, it would be irrational, as we've seen above, to deny the claim that vaccines are safe if there is compelling scientific evidence that supports it, and good reasons to trust the experts and the institutions providing those evidence. But to expect someone whose embodied experience of safety or medical efficacy relates to certain ideas and values about nature, disease, and health to pick up the safety and efficacy of vaccines in the same way as an expert for whom holistic ideas and values of health are irrelevant would be to deny the very multiplexity of reality recognized by Anekāntavāda. And I agree that we can go back and push my position by again listening to the first objection and make it even stronger, right? Because somebody could push by questioning the rationality of those ideas about nature, health, and disease that the CAM vaccine refusers hold, because they could be deluded, not well trained, they could be charlatans, their ideas could be the product of wishful thinking, and they are dangerous for public health, especially for those with immunocompromised conditions. And here, this is where I think dialogue is very important, and Anekāntavāda in particular, because the characterization of these vaccine refusers is very important. I am assuming that this CAM vaccine refuser is not a charlatan, is cognitively receptive to epistemic reasons, is open to discussions of their own ideas, beliefs, and even practices. It's authentically interested in science, and it's concerned, authentically concerned about their well-being as individuals, but also about the well-being of their communities. And so, for this reason, in this particular case, if we are indeed dismissing this type of vaccine refusers, then I think that it would be wiser to engage with them in public argumentative and formal discussions about their ideas before labeling them as deluded or dangerous. The reality is that very little effort has been made and was made during the pandemic to understand the beliefs of these type of vaccine refusers, who were usually boxed inaccurately, in my opinion, as anti-vaxxers or anti-science. And so here I arrive at the conclusion of my argument that from the Anekāntavāda principle that contrary properties can be attributed to an object without contradiction, we can conclude that there are simply not enough reasons prima facie to see these beliefs as false, or to label this type of vaccine refusers as irrational, as immoral, or misguided in any obvious way when they refuse to follow official public health policies about the COVID-19 vaccine, even after agreeing with the facts. The application of Anekāntavāda in its epistemological aspect allows us to see that we do not have to hold a relativist position to acknowledge the validity of these groups' beliefs. Because after all, as I said, Anekāntavāda is not a relativism. I think we can see Anekāntavāda as a perspectivist theory of knowledge, that when disagreement stems from the very reality of the substantial constitution of the object, and this is important, right? When disagreement stems from the very reality of the substantial constitution of the object in question, then there are no grounds, neither moral or rational, to refuse dialogue among those who derive contradictory beliefs from the representation of compatible properties of the same object, right? So if the properties of non-herbal can be attributed, in fact, to the vaccine, and then that representation in relation to how it determines the meaning in the way in which a person understands that according to their own values, then that's why I think we need a framework that makes it possible to dialogue, even in these very controversial cases. So since the substantial mode of an object is legitimately picked up in different and sometimes incompatible ways by different groups of individuals, and since there are simply many more irreducible values implicated in the decision to vaccinate than the ones usually assumed by biomedical experts, then it would be better to embrace value pluralism in matters of public health. How? By engaging with dissent through public rational dialogue, by having institutions and medical experts exercise epistemic humility and empathy, and by having authorities who implement strategies that acknowledge disagreement and rationally engage with those who dissent, not necessarily about the facts, but about how to make sense of them. And here I'll finish with this quote by Qasim Qassam, who has a study on the general case of vaccine hesitancy, where he says that there might be all sorts of reasons for judging that those who think this way, that is, the vaccine hesitant individuals in general, are somehow missing the point. But it is at least not obvious that they are missing the point as they see it, or that their beliefs about the safety of vaccines in relation to their own children, their own family, their own person, their own communities, and their own sense of health are straightforwardly false. Um, these are my sources, and I just want to complement that quote by saying that the appropriate application of an Anekāntavāda to public dialogue on matters of health, I think, suggests that official strategies should redirect their effort to focus not only on convincing people that they are wrong about their beliefs about vaccines, but on showing epistemic respect for rational disagreement about public health policies. And this entails engaging with dissent as an opportunity for creating collaborative, democratic, and non one-sided ways of guaranteeing health and safety for all. Thank you for listening.
Thank you so much, Professor Funes, for that wonderfully clear and thoughtful and judicious discussion. You made a lot of really important and helpful distinctions, which is what I think good scholarship is all about, and indeed what I think Anekāntavāda is very much all about, making important distinctions. And in fact, I just used the word judicious to describe your talk, and judiciousness is in fact one of the prime values for classical Anekāntavāda. They often use the Sanskrit term madhyastha, literally meaning, moderation. And not only that the users of Anekāntavāda should be judicious or moderate, but also that, the audience also needs to be somehow judicious and needs to be presumed rational, be able to respond to the arguments that Anekāntavādins are making, which is very much, I think, part of the picture that you're painting. And so I'm, of course, gratified that you've seen fit to cite the results of my own research. As I said in the beginning, one of the things that attracted me to Anekāntavāda in the first place was its applicability to big problems, as I saw it. But, I've really focused on the theory rather than the application. And, I feel like we really need to get clear on the concepts, or I need to get clear on the concepts first so that, I don't misuse them and get myself all confused. And so I've myself been trepidatious to take that next step and apply it. But I'm I'm very grateful to you for taking that step and for taking seriously the theoretical research that I myself and others have done, and go further and build on it and seek to apply it in a really rigorous, clear-sighted, and, as you said, appropriate way. Um, and on that topic, I wanted to address one question that was in the chat that was already answered, that Chris already answered offline. I mean, he typed an answer. Richard Kovac said, "I applaud your courage in confronting this topic. Was it trepidatious in choosing to do so?" And I will say that insofar as when we were thinking about hosting these and thinking about the topics, I certainly saw this as a difficult, and I had some trepidation, and I saw this as a difficult and possibly risky topic. It's a hot button issue, and that's one of the reasons that's another reason I didn't mention for why I've been trepidatious for applying on Anekāntavāda. But it's so important, and I really applaud you for having taken it on and done so in exactly, I think, the way that we need to. And of course, we have to do this. One thing I want to say to respond to, you sort of asked the question of whether you cited my research when in regard to a proposition like vaccines are safe. And you said quite rightly that Anekāntavāda is not relativism. And so maybe when they're just sort of true propositions, we shouldn't say, well, they're true in some sense and false in some sense. But actually, I take it, and so I totally agree with the basic framework, but I take it that a proposition like vaccines are safe is exactly the kind of proposition that Anekāntavāda could be applied to in very much some of the ways that you did. You know, it's such a general proposition. Vaccines are safe is kind of almost uselessly general and abstract. You know, they are safer than not safe. We have to nuance the senses in which we say vaccines are safe, and we know that some people have adverse reactions to vaccine, and so that actually so the question of whether vaccines are safe, there's not a simple answer to it. We can say yes, they're safer than not. We could say yes, we should deploy them, but we'd have to really complicate and nuance the ways in which we're making a statement like that, and in a way that does justice to people's concerns and people's experienced and in fact empirical evidence of when vaccines, you know, might go wrong, without propagating falsehoods about that they just, you know, do all sorts of crazy things, right? So we have to be nuanced and careful about it. So that brings me to Kojin Bohanek, our Arihanta Institute's Institute's own Kojin Bohanek, who says this is a great conversation. During the pandemic, I was quite vocal against anti-vaxxers, but then one of my oldest friends gently reached out to me and let me know that his daughter was one amongst quote unquote statistically insignificant number of people who did have an adverse reaction to childhood vaccines, and she nearly died from complications. When the vaccine mandates were being issued during the COVID pandemic, he and his family were understandably against getting vaccinated. Under these conditions, his decision was not only understandable and rational, but I don't believe that it can be considered unethical. I think there's a sort of utilitarian hegemony that's assumed amongst those of us like myself who advocate for vaccination, but we must never forget the tension between deontology, that is favoring the rights of individuals, versus consequentialism, which favors the collective. In consequentialist positions, we must not assume the worst about those who take more deontological or individualist positions. So thank you for that, Kojin, and that's sort of the kind of thing that I was just alluding to, that, you know, there's different considerations, and although we can say that vaccines are in the vast majority of cases important and good and helpful, and they are good, you know, in the aggregate for public health, we have to be able to acknowledge that there are cases in which people have adverse reactions, and that if we absolutely ignore those, then we get the vaccine hesitancy as one result, among others. So, okay, Anna, do you want to respond to that anymore before we go on to the other questions that were asked?
Yeah, no, thank you for that comment. I really didn't go into the ethics of it. In fact, I stayed a little bit more closer to the epistemological aspect of the argument, because the particular case that I was trying to understand, and you know, my friends and several people share that view of hesitancy about the COVID vaccine, was in terms of course, it was in terms of how issues of how to deal with people's health was at stake, right? And so for me, that was an epistemological issue first, and then it was misunderstood as ethical, because for people who decided not to get vaccinated, you know, not due to grievances, but due to specific ways of understanding health and disease. I think I wanted to try to understand the epistemological aspect of the debate, because I still think that these people are not considered part of the dialogue, and again, because it usually turns into the danger aspect of the dialogue. Oh, but if we listen to what these people have to say about vaccines, then a lot more people are going to start doubting the efficacy of vaccines. And so that's why the dialogue never gets started, right? And the people start being dismissed for being individualistic or selfish. So I didn't go into the moral aspect of the issue. I stood more with trying to understand the epistemological basis for the disagreement.
Great. Thank you, Anna. Moving on to our next question in the Q&A. I'm going to start from our last question from the audience from Chellamutu Rajamani. Since Anekāntavāda teaches us that truth has many sides, how can doctors in a cancer clinical trial treat a patient's spiritual and personal values as being just as real and important as the medical data?
Well, this is a question that needs to be taken very seriously and very carefully. After I wrote this paper, I began looking into this very hard question. Can there be dialogue between alternative views of health with the more biomedical views of health? And there are many issues, there are many difficulties that require experts, that require thinkers, that require people knowledgeable of the weight of values in people's lives versus the weight of how is scientific fact, how are the scientific facts being represented in people's lives in light of their perspectives, in light of their religiosities, in light of their phenomenological experiences about their own bodies, right? And so I think we need an interdisciplinary body of people who will take these questions seriously. I don't have an answer for this. Um, I, I think this needs to be studied more.
Thank you. If relating to that, but maybe if we can, I think putting a slightly finer point on it, Jonathan Dickstein, Arihanta Institute's own, um, uh, thanks you for your presentation and especially your linking of a philosophical tool to a real world topic. Jonathan says he remains curious about your suggestion during the talk that it's wrong to refer to CAM vaccine refusers as anti-scientific. Is it not accurate that this group rejects expert institutional scientific conclusions, aka science?
Yeah.
Jonathan says, I'm not suggesting that science is necessarily right or moral, but doesn't this group often proudly self-identify as being anti-mainstream science?
Yeah. Yeah, it's true. Thank you for that question. And yes, I think there are very um, difficult conversations there to have because, and I'm making a distinction here in my talk between biomedical ways of understanding health versus these non-biomedical ways of understanding health. And I think that my position is to not necessarily or immediately box all alternative use of health as anti-scientific. So there might be some CAM views about science that are anti-scientific, but I don't think not all of them are. I mean, there are people who are authentically interested in evidence about or generating ways of creating evidence for benefits of these alternative ways of dealing with health and disease. And so I don't think we should box all of the alternative views of medicine as anti-scientific just because they disagree with biomedical science, because I think they are making us ask the question, can we have a science that incorporates biomedicine and these other concerns? And perhaps can we rethink science in ways that addresses the concerns of people who don't align with some of the values that are at the basis of biomedicine, you know? So I think that we have to open that conversation and ask the question, what type of science? Because there is a really good book about the history um, of alternative medicine and why and the processes through which it became marginalized. And it's not only in terms of scientific considerations, there are political considerations, there are economical considerations. So it's not just that they are refusing biomedicine because they are refusing science overall. I think there is a bunch of people who want a scientific way of understanding these more holistic forms of dealing with health and disease. In
Thank
a
you.
way that, and primarily because I'm very interested in this topic, because one of the main objections that I see coming from alternative use of medicine to mainstream science is that mainstream science portrays itself as objective, right? But our bodies are not just an object, right? So what can we think of a science that brings in the subject in some way, you know? So yeah, I think we have to be very careful in these categories.
Mm. I think that relates to the question we've gotten from Ann Mako, who thanks you so much for the interesting talk and is wondering, would the stakes of the discussion change at all if we asked whether people rejecting vaccination were being reasonable rather than rational? Does reasonable make more room for empathy in a situation of factual disagreement? I think since we're getting toward the end of the time, I actually want to pose a few questions at once, if you can. I just read because I think there are a few things that hang together here a little bit. Pritan Bangdiwala has also thanked you for the excellent presentation and asked, what if we add a second dimension on Anekāntavāda, that is the three jewels, right perception, faith, right knowledge, and right action, on the application of vaccines. Lots of false information was pushed in social media of side effects for children, like not being able to conceive, heart tissue damage, etc., not having faith on their doctors and not taking the time to do primary research and not take the vaccine. So what happens if we bring in the three jewels to that conversation? But then, one of the jewels is right conduct, and you've said that you're not talking about ethics, but Shobha Vartaman says, thank you for a very informative, judicious, and well-arranged argument, but thinks that it might be more appropriate to apply the doctrine of ahimsa because vaccine refusers, cause himsa to others by not being vaccinated. They have no right to be dangerous to others' pranas. There's no space for one's own beliefs or rights, or even Anekāntavāda. So, how do you respond to those?
Yes, I mean, yes, I acknowledge that there is that right. I mean, what I presented is incomplete, right? We would need to include the right conduct. Okay, you have this type of people, they might not be fully rational, they might be reasonable, meaning that, we could have a conversation where they agree with the scientific facts, but they still have disagreements about how to deal with health. How do we deal with the danger that they pose to the rest of society? What would be the right conduct of these individuals? But the thing is that I think we need another talk addressing the question: should these individuals vaccinate despite their disagreement, or what are these? Should we isolate these individuals? What should these individuals, despite their disagreement, follow the indications of the general consensus? I mean, I think we need to develop a talk for this. I think my answer to this is that I don't want to give a concrete answer because I think we need to be very careful. If we're going to establish a dialogue with these particular type of cases, then let's bring to the table questions about what is right? Because I mean, an easier case was the question about not the vaccine, but the covering your mouth and your nose, right? Perhaps people didn't believe in that, but out of respect for others' concerns, they would do it, right? Could that be applied to these cases where perhaps they don't believe that this is the right way of addressing their health or their their protection. But given that the majority of society is concerned in this way, they should somehow support the general consensus. I mean, let's pose it as a question, but I don't have an answer. I don't want to give an answer because there are different aspects of the ethical question that would need to be clarified first, in terms of values, in terms of principles. I mean, I don't know, like, are we to follow a utilitarian view on this? Or can we respect that people have principle views on how to make their decisions in terms of science included? So it's not, I don't see it as easy as saying, well, let's apply the utilitarian consequentialist view of ethics, in which case they should do this, right? Should we? Is utilitarianism the only way to think about the moral issue here?
Well, great questions. I think too there's so many more questions we could ask about this and don't have time for. So I think that might be a good spot to stop for the day. Thank you so much, Professor Funes. I found this really, really illuminating and helpful, and at least a very, very good start to the conversation.
Thank you. That's all what this talk wanted to pursue, an opening for a real and authentic dialogue. And I think Anekāntavāda is a powerful tool for doing this. So thank you for the invitation and your audience.
Great, thank you.
I'd like to thank Professor Anil Mundra for presiding over this event, and thank you so much to Professor Ana Funes for an incredibly engaging event, right in the spirit of what this was organized for. I'd also like to thank my co-organizer, Professor Anil Mundra, for helping to organize this entire series, the Engage Anekāntavāda speaker series here at Arihanta Institute. And I'm feeling like there might be another event with Professor Funes at some point in the future with us, because there's so many questions that remain unanswered, and also more that this provokes. So thank you to both of you for being here. I also want to announce the next event is going to be on September 1st. It's a little whiles away. We'll let everybody know. Anekāntavāda Theory and Praxis with our colleague Janesh Sheth at the University of Birmingham. So we're very much looking forward to that, and we will let you all know. My colleague Diana Hewlett has dropped the registration link in the chat. And I just want to once again thank my co-organizer, Professor Anil Mundra, and Professor Ana Funes for all of your efforts and everyone who joined and engaged in the conversation today. So with that, we'll let you all go. Wish you a wonderful morning, afternoon, or evening. Jai Janendra.
Thank you.